Hi, everybody. And thank you again so much for joining for another episode of Coro Chronicles. And today I have to say, as all of you, I get to hand select the people that I bring on the show. And actually this individual I selected, but I was actually introduced to. And then I started to stalk a little bit online. And I don't want to take away from her introduction, but Dawne is someone that I got to witness at an Alzheimer's conference, and it blew me away to be a part of the Alzheimer's Association, but witness someone that's a leader that was walking the journey themselves. And I don't want to give away too much. So, Dawne, tell us who you are, your title, all that kind of little stuff.
Thank you so much, Debbie. I'm so happy to be here. I am a regional vice president with the Alzheimer's Association. So I live here in Tennessee, but I have the privilege of working with Tennessee, Alabama, Mississippi, and Louisiana. And we work every day to support the families who are within our communities. And we do that in a robust way. So we're the number one nonprofit funder of Alzheimer's and all related dementia research, but we're also providing those support groups and education programs to help families who need us today. And I think one of the most important things that we do is build awareness in the community through opportunities like this to ensure that families know we're here to support them and they don't have to walk this journey alone. So we work with a lot of media partners to make sure we're building awareness. We have our Walk to End Alzheimer's every fall. We have 10 of them across the state of Tennessee. And that's a great way for families to come out, and oftentimes they learn about us at the walks. We have another signature campaign called Do What You Love to End Alz, which is you can do whatever you want to support the Alzheimer's Association, and we love that one. So that's what we do every day. We want to make sure that families know we're here and that we're providing that help today, but also that hope for the future.
I love that. And I hope that everyone that's listening or watching already know about the Alzheimer's Association. But I do think there's such a different dynamic when they get to meet the people and stuff, that it's not just the organization in Tennessee. And when you rattled off all those states, I don't know how you even have time for us. So I am super, super grateful. But I do want to take a little bit of a back step. I want to share with everybody more of your story, because I know you've been with the Alzheimer's Association for a number of years, but I really want to go back and how you came about to choose the Alzheimer's Association. What was your journey getting here?
Great. So actually this week is 6 years with the Alzheimer's Association. So I started in 2019, which was right before COVID, which was a really interesting time, right, to join a new organization. Prior to this organization, I was with ALSAC, which is the fundraising arm for St. Jude Children's Research Hospital. So I had a similar role. I was a regional executive director leading Middle, East Tennessee, Kentucky, West Virginia, so multiple states, but we really exclusively focused on fundraising. Before that, I worked for a global organization called UNICEF USA. I led corporate development for UNICEF. That was out of New York. And then I moved to Nashville and worked remotely. Really, my partners were all across the country. So I just needed to be near an airport. Before moving into nonprofit, I was in the private sector. So I ran an ad agency in New York City before that. And I was trying to figure out how to translate what I love, which is building relationships and working on multifaceted programs and campaigns, but then bring it and translate it to helping people. And so for me, that I started an informational journey with different nonprofits to just figure out where I wanted to focus my energy. And really at first it was, I wanted to focus on women and children. And so that was where UNICEF came. And then obviously St. Jude is also a children's organization. And then I was approached about this opportunity with the Alzheimer's Association. I wasn't necessarily looking at the time, but what I loved about this organization was that I wasn't only going to be fundraising. I started my career in politics. I started working for a senator in DC, And now I work on policy. So I actually work on policy at the state and federal level as part of my role here at the Alzheimer's Association. I do media engagement, so that kind of benefits from my background in media. And then really just my passion for the cause. At the time, my mom had not been diagnosed, but we had concerns. And so for me, learning about the Alzheimer's Association and the mission resonated a lot with what we were experiencing within our own family. And it just felt like the right time to make the leap and come over to the association.
Wow. I knew I was going to learn a lot today, but I've already learned so much about you in the first 5 minutes. If you wouldn't mind, I would like to share with our audience a little bit, because I had expressed a little bit in emails beforehand, is that because you have such an interesting perspective. And like you said, it was that you came on with the Alzheimer's Association and hadn't started your own journey. So with starting your own journey and being a part of this organization in such a pivotal role, I have to imagine you had a very different lens, because you were looking at the association for what it could help you as a caregiver, as a daughter.
Right.
If you could share a little bit about that.
Sure. And our journey was similar to others that you might hear about. At first, it's just worried something's going on with mom. She's repeating herself a lot. Everything has to be on post-it notes around her apartment. She was still living independently. She was very impacted by the isolation of that COVID year. So, because she wouldn't let us see her, she was very scared. And so it was almost an entire year before we were in a room with mom again. And that isolation of just communicating to her through a window, through by phone, by video, and her not, socializing or doing anything with her neighbors and her community, which she had always been, she had great friends. It really impacted her. So we saw a very quick progression with mom during that sort of 2019, 2020 year. And I think it was Easter of 2020. And my brother lives in Florida. My mom was living there as well until we moved her here 2 years ago. And she was driving home from my brother's, a drive she's done a million times. He lived about an hour and 15 minutes away from her it was Easter Sunday, and she got lost for 5 hours. And so that was the phone call from my brother here to me, and I'm in the middle of my Easter with my husband's family, and I haven't heard from mom. We can't find her. And it took 5 hours for my mom to kind of reorient. She was very upset. She had asked for help a couple times, she remembers afterwards, she went into a hotel and asked for help. She went into a gas station and asked for help, and nobody helped her. Nobody tried to call us, and nobody tried to. And so ultimately, she ended up sitting in her car, not knowing what to do, and just sitting in a parking lot until my brother was able to get her to pick up the phone. And so he went and got her, and she was terribly upset. And that allowed us to have the conversation about her seeing a neurologist again, because we had already seen one neurologist virtually during COVID. And this was, Mom, I think it's time for us to go and talk to them again and potentially do the cognitive testing that would ultimately lead to her diagnosis of frontotemporal dementia.
Wow. I'm so sorry for that. Goodness, I can't imagine. And then there's a part of me just envisioning her asking for help, and people and I think that's something that a lot of us need to be aware of, is that sometimes we'll see like the silver warnings of
Right.
there's someone that's lost, kind of like an amber alert, but a silver alert, and keeping our eyes out. But even just that, it's really, I hadn't even thought about that, but having an elder approach me who, just like a toddler, if a toddler walked up to any of us, we would not let them go.
Exactly.
Yeah, we would hold on to them until we got them help and got them taken care of. But for adults and elders, it's just what your mom experienced.
And
And
we do try to build awareness with the hospitality industry, the banking industry. So actually wealth advisors who maybe see their clients 4 times a year, or a financial advisor maybe only sees their client a couple times a year, they actually start noticing symptoms sometimes before a family member might, because they're maybe requesting unusual changes to their accounts they wouldn't normally ask for. Even within a bank, if a senior walks in and asks for something that raises alarms, we want to make sure that those types of industries, those professional services industries, are aware that we're here to support them. And that's why Edward Jones is one of our biggest national sponsors, because they've seen the impact it has on their clients, and they love that they can be a resource for them. So we do try to raise awareness in the community so that these types of things don't happen, because it is so sad to think about her trying to ask for help, but not even remembering how to get in touch with us and ask us for help. It's heartbreaking. It really is.
Yeah, I love that about, and you're so right. When you think about what we do, especially as adult children, if we're around our parents or even our elder neighbors, we're around them so often that sometimes we don't see those shifts, versus someone who sees someone 4 times a year. There's identifying markers that, and yes, especially on the other side of things, is that we know is that when it comes to scams and things, that it's almost our elders are the ones that become the main target.
And we saw that with mom. So that's a very sort of, there's these sort of junctures in the beginning stages that are really hard, these transitions for the families. Oftentimes, that individual's holding on for control as tightly as they possibly can. And navigating that with love is really sometimes hard. It's frustrating for some caregivers. And it's when do we take the car away? When do we take the phone, change the phone? When do we change the computer? Do they have social media accounts? It took us it was maybe a little too far along when we took mom's Facebook down, because she would be thinking she's texting us individually, but she would be posting it on Facebook. So she would be confused. And so we had some things in place where I don't think externally anyone could see any of that except for family members. But so those transitions are really difficult in the beginning, and that's very common in those early stages, and then determining the right care for your loved ones. So ultimately, we did move my mom to Tennessee 2 years ago. I'm just a little bit better positioned to care for her, especially as she moved into the later stages of the disease. One, obviously, I'm her daughter, and there's a lot of intimate settings when you're caring for someone, maybe changing a diaper or keeping them clean. And so I was just in a better, and I have a lot of resources and a lot of support, obviously working for the Alzheimer's Association here in Nashville. So it was time for me, and I really valued that time with her. It was very special, a very special 2 years with my mom.
Would you mind sharing one of those special moments with her?
Yeah, my mom would she would have this disease is so diabolical, because one day there's no cognition, and then it's like the next day, or maybe it's an hour in a day, you get these glimpses of that mom that you remember. And my mom loved telling stories about when she was younger. And one time we were with my brother and I, and we were talking to mom over a meal, and she starts telling us about this boy she dated in high school who had a motorcycle, and she's telling us how much she loved being with this guy, and we had never heard the story ever. I don't know how long they dated, but he would pick her up on the motorcycle, and she just was loving it. And it was back in the probably the late 50s, 60s. So you can just imagine mom jumping on the back of a motorcycle as
Go,
a
mom.
teenager. It was so great. And so it was these glimpses of mom that we just would hear these stories. And so we would try to grab a recording and kind of capture some of them. So we have a couple moments like that. My mom was very smiley. She smiled all the way to the very end. Every photo I have of her, even in the late stages, we were very blessed because so many of our loved ones who progress in this disease develop behaviors that can manifest in anger and can manifest in a negative way. And for my mom, she was a little more feisty before her diagnosis and maybe a little bit more challenging from her personality perspective. And as she progressed in the disease, she just was very sweet and always had a smile on her face. And so, really, all the way until the very end, she just had a big, beautiful smile. And we were very blessed by that.
I love that. And I love that story. Jumping on the motorcycle. I couldn't imagine, but sitting at the table and learning this story about your mom and just be like, what?
I know. It was
Oh,
great. And she loved talking about my daughter is 13
mhm.
and it's my understanding that my mom definitely gave her parents a run for their money when she was younger. And she was born on the 4th of July and she would always talk about the fact that she was a firecracker.
Firecracker.
And so when I would tell her stories of my daughter, who's 12, 13, just turned 13 in August, my mom would go back and be like, "Oh, I put my parents through it," and she would tell us some stories, and she was proud of it. She loved it. That
Awesome.
was so. Those are those memories that stay till the very end. It's really the more recent memories that are very hard for them to remember. And honestly, she didn't even remember my dad in the end. They had been married for 25 years. So she knew his name, but she really wouldn't be able to tell you very much about my father. So it's a crazy disease.
Yeah, I spent my first 5 years with Coro in memory care. And I used to go to the communities on a daily basis.
Sure.
And it's interesting when you talk about spouses because there's memories. Like I always tell everybody, it's like there are people that we meet along the way of this journey that just stay with us.
Mhm.
And there was a woman that I had met, and her husband was in memory care. And she would come to visit him. It just seemed to be that our timing always matched, and I would run into her. And there was one day in particular, I knew who her husband was. I had seen her visiting and so forth. But one day I came in and there were three of them sitting on a couch and he's holding hands with another resident, a female,
Mhm.
sitting on the other side of him. And I looked at her because I didn't know what to say. And she tried to kind of address the elephant in the room kind of thing. And she just said this, she reintroduced me to her husband like she always did. And then he introduced me to his girlfriend.
Oh gosh, it's so difficult.
And yeah, when you talk about this disease and the stories, what people remember and then what they may struggle with. And yes, more recent is the more difficult time. So you brought up your daughter. What, going back to that part of the journey, how did
Mhm.
that conversation or that initial conversation with your daughter?
It's hard because my Olivia really only remembers her grandmother in dementia. I mean, she can see photos of my mom from 10 years ago when my maybe my mom was starting to show some of the early stages of the disease. My mom became very delicate and she was only 60 years old and or even 70 years old, just she would move as if she was just uncertain of her footing. And I think that's just part of, the way that they see very differently. And so I think for my daughter, we would go and visit a lot. And my mom was in memory care and we would bring cupcakes for all the residents and Liv would be handing out cupcakes and just trying to smile and chit chat with everyone. Obviously, as so many of those residents have nobody visiting
Yeah.
often. And so anytime we went, we would always try to visit with some of the other residents. We would get to know them. I think I remember a couple years ago kind of driving away from a visit with my mom, and Olivia was probably 10 or 11. And she just looked at me and said, "Well, how old are you going to be when you get dementia?" And that was that moment for me where I knew that I would be in this fight forever, because whether I'm with the association forever or not, this fight is personal, and this is I will continue to ensure that our future generations are protected. I never want my daughter to be my caregiver. I mean, being a caregiver for my mom, as fulfilling as it was, probably one of the hardest things I've ever done. And I never want to put my daughter through that. And I'm a little bit older, which means that she would be younger to if she had to be in that position. And I don't want this taking over her life. And that decision is very personal. A lot of people, everybody has a
Different. Yeah.
perspective on it. And I've always said to my family, put me somewhere nice, come and visit me every once in a while. Because I know that, and again, we were lucky. My mom didn't really remember how frequently we had visited her. So if I could see her the morning of that same day and come back,
Oh,
she
yeah.
was like, "Oh, it's so great to see you." Or I could be out of town for a week for work or for on vacation and come back, and she wouldn't even realize that time had passed. But then there's others who keep track of, why are you not here? Why are you not visiting? So that's really difficult. So I think for Olivia, it's hard because my mom wouldn't remember her as much. She was the youngest grandchild. And so she started forgetting Olivia really a couple years ago. If we were together, she would know she was my daughter, would never remember her name. We look very similar, my daughter and I. My cousins would come and see my mom, who were in their 60s, and my mom would be like, "Oh my gosh, Kelly," and weep. And my daughter would be like, "How does she know them who never see her? And I
Yeah.
see her all the time. How does she remember them and not me?" And so I think that's really hard as a child to understand that piece too.
Which I've never asked this question. I've never looked it up. It's just having this conversation about Olivia. Are there programs for children with the Alzheimer's Association?
Yeah, there's some books.
Okay.
We don't have any children-centered programs that we offer. It is a family impacted disease, especially if you're caring for your grandma at home and the whole family, everybody's pitching in. I think we were just as transparent with Olivia as we can. My daughter does a fundraiser every year for the Alzheimer's Association. That's in the spring, and she does that with her friends, and she's done it for years. And so she gets it. She understands the cause. She knows there's a family impact. And hopefully, we don't have a genetic background in my family other than my mom's sister. My mom's sister passed away a couple years before my mom with undiagnosed, but probably Alzheimer's. Very textbook. But then we look back in our family history and we don't see any other history.
And it's interesting. Going into that, because now I want to shift a little bit, because now that you've had this journey and had this lens, and now being able to see and be a part of these conferences and events, and obviously being a part of the association, you're at the forefront of knowledge compared to us of the tests, the medications. That was one of the things, like at the event when you and I had met, like I was taking notes because there's conversations starting to occur in my family. And I'm trying to figure out how to frame things. But there were things that I learned about medication testing. So I would love to hear more of that side of the lens, so to speak.
Absolutely. And I'll just add, just so that we share this often throughout the podcast, we do have a 24/7 helpline that I called very early on. I have a team of professionals who are very knowledgeable. Sometimes it's just easier to talk to somebody who doesn't have a personal connection to what's
Connection.
happening. And they've seen every scenario imaginable. And that number is 1-800-272-3900. And 24/7, it's available in 170 languages. You can reach a master's level clinician if you're having very specific questions about medications and things like that. So again, that number is 1-800-272-3900. And I cannot recommend them enough. And what I loved is after we would talk, they would send me a written summary of what we had discussed, and I could forward that to my brother. So I always felt like my brother and I were on the same page with some of the transitions that we were going through. And
I love that.
it's great.
Oh my
It's
gosh. And the
it's
transcript, because you're right. And whenever we're going through any type of trauma, there's studies that talk about witnessing a car wreck. Like
yeah,
you just
the
cannot remember
recollection.
everything. And especially when you're emotionally invested in this and you've got
Absolutely.
your own fears and worries and did I ask the right question, but to have that transcript after and then send it to your brother, other family members. So it is just like that you're
Yeah.
not having to play telephone and missing something. Yeah, we'll make sure just for y'all
Right.
watching, listening, we'll have that and the details below the
Please,
podcast.
please. Absolutely. But as you said, there was a lot of hope for in this field. And I will just say that there are a lot of very smart people working on this issue across the globe. And we have a global conference every summer called the Alzheimer's Association International Conference. And we had record attendance this past year, over 13,000 researchers were in attendance, both in person and virtually, but there was a huge amount of people in person in Toronto. And at that conference every year, they make big announcements about progress that's being made. And then throughout the year, we're hearing updates. But we now have two treatments that are FDA approved that address the underlying cause of the disease. And they're really only targeting early stage Alzheimer's or mild cognitive impairment. So these treatments are both the same class of drugs that address one of the signature hallmarks of Alzheimer's, which is amyloid plaques. The other signature hallmark is tau tangles. And so these are both anti-amyloid monoclonal antibodies that are infusion therapies that will clear the amyloid from the brain, which slows the progression of the disease. So these aren't the cure, these are not the silver bullet, but they are slowing the progress of the disease. Before these two treatments, the only medications that were available were to help manage some symptoms. And so these are really important breakthroughs, and we are hoping to see anti-tau treatment hopefully approved in the next year or so, which means we might be moving towards combination therapy as we move into 2026. So there's a lot of exciting progress being made on the treatment side. But the other side of it is that diagnosis is very challenging. Up until recently, most diagnosis is done clinically. So my mom was diagnosed clinically, which is a series of cognitive tests, written tests, sometimes computerized. My mom underwent a 4-hour test. It was really hard for her. And they were able to make as close of a diagnosis as possible. But now there is a PET where they can confirm the presence of amyloid or tau, but with frontal temporal dementia, amyloid wouldn't come into play. So that PET scan is now available. Spinal fluid can be tested, and there now is a blood test that was cleared by the FDA this year for confirming a diagnosis. It's been used a lot in research. It is really meant for individuals that are over the age of 55 and having symptoms. We don't want everyone going to their physician and asking for a blood test because it's a very complicated issue, and that you certainly don't. Sometimes the biomarkers can be hard to translate by a physician if they're not highly specialized and trained in the translation of these tests. You don't want people you don't want to lead to anxiety or depression because somebody may or may not get Alzheimer's because of a blood test. And so I think until we have some improvement in how the blood tests are translated, for now, they really are meant for anybody who is currently experiencing symptoms.
Wow. And I just think back to, it's funny, I think back to the very first Alzheimer's Association meeting I went to, and it was talking about CT and it was talking about symptom management. Honestly, that's one of the reasons why Coro even came to the forefront of long-term care, was because our founder had discovered over a couple of different scenarios about how just the power of music wasn't accessible as a tool. And it's funny, you talk about agitation and depression. That was the other thing that we had learned, even when we were talking about before, which I love that your mom still carried her smile with her, is because the disease does impact people so differently.
Yeah.
And then that's when we found out that one of the last regions of the brain to be touched by this disease is where music, memory, and emotion all intermingle. And so we were creating music programs using autobiographical music that's part of your soundtrack.
Yeah.
You have your comfort food, having that comfort music. And when we went through a clinical trial, it was to reduce pharmaceuticals that were just trying for caregivers, trying to care. And we know what that means. And so when the clinical trial came back, it was using the power of music, and it was able to reduce agitation and depression 54%.
Absolutely.
So I think that's another part of this world now, is to be able to identify things early, but then even when someone's in your care and having those toolkits and access to different things, music, faith, family, relationships. I do agree with the Facebook, who she went through a very similar experience with her dad. And now with what you're saying, it just blows my mind of when I was in the audience just a handful of years ago and what you're telling me and telling us today. Going into a little bit of, which I love this, your political lens and what you're advocating for and doing.
Yeah.
Can you share with us some of the things that you're that's trying to make a big pivot in our country?
Sure, absolutely. So we focus at the Alzheimer's Association on policy at the federal and state level to help support communities. So really our main focus at that federal level is to ensure that funding for Alzheimer's research from the US government, through the NIH, and that funding has increased tenfold in the last 10 years. We're now up to 3.9 billion that's invested by the US government through the NIH. And we're very proud of that. And even in today's environment, we feel confident that funding is not going to be impacted too heavily by any of the changes that are happening. And I think to start hearing so often at the federal level about Alzheimer's and the same conversation with cancer and other diseases. If you look at the top 10 nonprofits in the country, there's only one Alzheimer's Association. So if we're not advocating at the federal level, who is? And then of course, we're advocating at a global scale. And then we translate that back into our communities. So here in the state of Tennessee, we've been working really hard to build an infrastructure of care for the families who are impacted by Alzheimer's and dementia. We have almost 130,000 Tennesseans that have reported a diagnosis. So we know that's probably a very low number compared to what's actually the reality of that situation. But then we have over 380,000 caregivers. And so we need to ensure that we are supporting those caregivers as a state, and that we build that infrastructure. So we've been advocating. We now have a dementia director that is a dedicated position within the Department of Health. And that's largely due to our advocates and our advocacy work here locally. We had a respite care pilot that ran for 3 years, and we're hoping that becomes a permanent program within the state of Tennessee, providing again that respite for caregivers when it's
Oof.
needed and having that be funded by the state. The state now has 7 dementia care navigators that are located at the regional and county level. We hope to have many more. So that's part of what we've been working on. So again, those are state-funded positions that are there within the community to support families and provide them the information about localized resources, home care, PT. What are those memory care opportunities? Where can I go to be diagnosed? What do I do if I have concerns? So we want to make sure, because it really takes so many people working on this to ensure we're reaching everybody. And then capacity building in the state of Tennessee in terms of diagnosis is a big one. We have some wait times within the main centers that diagnose, and we want to look at how can we reduce that? How can we build capacity? Part of that is educating providers, and we do have a health systems division at the Alzheimer's Association that works with primary care providers, but also large health systems to ensure quality improvement for the community. Maybe reduce readmissions at the emergency room. A lot of times, these individuals are not managing their comorbidities properly, whether it's heart disease or diabetes. And so you're going to see them often in the emergency room. And how do we educate the staff, that frontline staff, those physicians and nurses that are seeing these patients coming in over and over? Maybe it's a UTI over and over again.
Oh, yes.
And so that's an important part of what we are doing at the Alzheimer's Association, is to really provide better health outcomes for our community, better support within the community at the community level. And we want to make sure we're taking care of our people. And there's a lot of progress being made. It's very exciting.
And we could do an entire episode, I know, on just caregivers.
Oh.
And obviously, you know that. And I have some close friends that are now making that shift and literally going from a daughter to almost a parent and making those adjustments. And I am definitely going to be making sure that they have this number that you shared with all of
Absolutely.
us on their refrigerator when they need it.
Yeah. And they call us the sandwich generation. So we're caring for our young children while we're caring for our aging parents. And it doesn't matter what that aging parent, if it's Alzheimer's, another dementia, cancer, the caregivers are all dealing with this. And then our legislation that we've been talking a lot about here in Tennessee, we did propose a biomarker legislation. We partnered with the American Cancer Society because it's disease agnostic. We want to make sure that we're providing access and coverage for these tests that we talked about, whether it's a PET scan, spinal fluid, the blood biomarker test. We want to ensure that private payers are also covering these diagnostics so that we can elevate early detection and diagnosis. It's going to be really important as we move forward and these treatments target the disease at the early stage. You can't wait until symptoms have progressed really far to be diagnosed. We have to be diagnosing earlier. So we also want to make sure to ensure access to coverage for those diagnostics.
I think from my perspective, I think in society's perspective, that people just didn't want to know. They didn't want to know if they had it because it's like the way they saw it is that if I have it, I don't want to know. But now I think there is a shift that's happening with education, and what the Alzheimer's Association has done and having these conversations is that it's just that now we want to know so we can slow down the progression, because as we know, there's not a cure for it, but to be able to minimize symptoms, to slow down the progression, to just have a better quality of life for a little longer before things kind of shift.
And that has changed so much.
Yes,
As you said,
yes,
it was the most feared disease because there wasn't treatment.
right.
Now we just every year we release facts and figures, which is a special report. We do that in March. And this past year we released a report, a special report with it about, do Americans want to know? And we did see that 79% of Americans do want to know before they start having symptoms. And so as we progress with treatment and testing, I think we're going to continue to see that number increase of what Americans want to know. And then the earlier you find out, you can make some financial decisions, you can make some long-term plans. But it's exciting that these treatments can slow the progression of the disease, give more memories to those families, and some more special moments.
No, I couldn't agree with you more. So I know we only have a few minutes left, and I ask all of people who give their time to our podcast, I always ask the same question.
Mm-hmm.
Out of everything I've asked today, is there something that you wish I would have asked you?
This is such a complex disease that it's hard to know sometimes where to start this conversation. There's a group that we're all here. This is a movement. We want folks to know there is hope on the horizon. There are investments being made in new discoveries, but also there's hands to be held on the journey. And when we have our walk season, we lovingly call the Walk to End Alzheimer's the largest support group of the year. And the Nashville Walk, it's coming up on November 8th.
Mm-hmm.
At First Horizon Park, and it's one of the largest walks in the country, and we'll have over 2,000 people there. And those are families who sometimes see each other just that one time a year. They come back together. There's a lot of resources available. And so I would just say that folks, talk to somebody. If you have concerns regarding your own memory or you have concerns about a loved one, don't let it go. Talk to your physician, talk to your faith leader, talk to somebody that's trusted in your community, call our helpline and ask what would be the next step. That earlier we can catch it, the better outcome there is for really everybody and for families, and maybe even treatment's an option at this point. And I think don't pretend it's not happening. Ask someone, ask for help, and hopefully we'll make some progress towards ending this journey for everybody.
Oh, amen to that. And you're exactly right, because for some of us, if we have the thought, we don't want to say it out loud.
Mm-hmm.
And we definitely don't, we are super fearful of having a conversation with a spouse,
Yeah,
with a child, with a friend. And I think that's another element of having that resource number, because it is 24 hours a day.
Yeah.
There are specialists on the other end, because we all know, like I bartended for a number of years in college, and I would have people come in wanting to share everything. And it's because I didn't have a vested interest. I wasn't doing anything. And so not comparing that, but for some people that are still struggling with talking about this or wanting to share, like, this is something I'm fearful of.
Right.
To be able to take that part off their shoulders and have someone, not just a neighbor, but to have someone with experience
Right.
and skill set that can help guide them. I think that's pivotal, because as we know, some people will just wake up at 2 o'clock in the morning and cannot go back to sleep. And sometimes that's the time to make the phone call.
Exactly. Absolutely. Yeah. Available 24/7. Yep, I agree.
Yeah, it's like when I used to go into communities and I would have conversations with the adult children, just because of what I was there for.
Mm-hmm.
And you always hear this. It's like meeting people where they are, meeting
Right.
people also go where they are. Don't try to bring them in today. And I think that's exactly the same thing
Sure.
with education and offering like this resource tool just by itself. Is that's what you're doing, is that you're meeting people where they are.
Right.
24 hours a day, 7 days a week. So I just have to thank you from the bottom of my heart for spending time with us today and sharing this. And just really, like I said, it's wonderful to have you on as what your title is in your profession and that lens, but also having you as a daughter who walked this path. I think that gives you, and I hate to say, put it in this, but gives you a credibility and a trust that a lot of people in your position, for us as people that are kind of looking for that person to trust, I think that's something that sets you apart. And I love that this is your mission, no matter if you're with the association or not. So
thank you, Debbie. It's been such a pleasure. Thank you for having me on.
Everyone, thank you so much for joining us for another episode of Coro Chronicles. And again, the resource number will be on the bottom of wherever you're receiving this podcast. And by all means, write it down, put it in your refrigerator, put it in a drawer. It'll be there when you need it. Pass it on to a friend, post it, share it.
Absolutely.
Because we just need to meet people where they are and making sure that they have the tools when they're ready.